Hi, my name is Mary Mannix and I'm President and CEO of Augusta Health. We are so excited that you are interested in Augusta Health, and it's my pleasure to introduce you to Augusta Health and tell you about all of the features and the exciting differentiators that our program will provide to you. Augusta Health is a very unique health system. First of all, let's start with our mission. Our mission is to strengthen the health and the well-being of all people in our communities. All people being underlined and communities being plural. Second thing I would lift up is that Augusta Health is an independent community-owned health system. We've bucked the trend of the mergers and the acquisitions and the large healthcare system. And all of our decisions are made through the lens of what is the need of the community, whether it be through the community health needs assessment, whether it be through the needs identified by our providers of services that our community needs, whether it be our population health team who has identified a particular healthcare disparity in a region of our community. That's what drives us. And then our model is very much about community partnerships. We don't do what we do for the community by ourselves. We have incredibly strong, very complementary, synergistic relationships with other organizations in our community, and together, that's how we work to strengthen the health and the well-being of all people in our communities. I think we have a really exciting internal medicine program in development that is going to be ready on July 1, 2024. And some of the things that I think will make this internal medicine residency very impactful are, number one, the cadre of faculty and preceptors that are coming together as a team to provide state-of-the-art education and training opportunities. In addition to that, we're very community focused, so the role that the continuity clinic will play in serving our community and the added benefit of our emphasis about health equity in the community is going to, I think, differentiate this residency. Residents will have the opportunity to be part of our mobile clinic network. Presently, we have 14 different mobile clinics a month, and that number is increasingly growing, where there is an opportunity to go into the different components and the different communities that we serve, all of whom have unique needs, and provide services. And I guess the additional thing I would say about, I think, what's going to be impactful about our residency is what it's going to contribute to the culture of Augusta Health. You know, we are a learning organization. Our mission is rooted in community, but the best way for us to push the envelope on professional development is through continuing to learn and having a commitment to learning. And my experience, having worked in teaching hospitals before, is that when you are a teaching hospital and a learning organization, your culture is just that much richer. The new mission statement clearly has an emphasis on access and health equity for all. And so the residents of Augusta Health in internal medicine will have that opportunity to have multiple rich experiences, wonderful training experiences, not only again in the continuity clinic where we'll be increasing access to care for our community, but also in that mobile clinic, which is really the heart of where we address healthcare disparities by going into the community, understanding what the unique needs are of that particular community or that particular neighborhood, partnering with other community organizations to serve the needs of those families. Another attribute of Augusta Health that I think makes us very community-centered and again unique is the Augusta Health Farm. This farm was born out of a collaboration with the Allegheny Mountain Institute, and it's just flourished. Not only is the food that's produced on our farm used to feed our inpatients and our team members and providers, most importantly, it's integrated into the clinical care of our patients. So whether it's a diabetic, newly diagnosed, that needs help in terms of nutritional training, meal preparation, etc., they have the opportunity to be a part of our farm, to understand healthy, nutritious options, to even get a cooking lesson and partake in preparation of food in our test kitchen. And the list goes on. The collaboration that we have with, for example, the Blue Ridge Area Food Bank, the different channels that we have of distributing food to those who are in need, whether it be through our regional offices or the emergency department. It's just a wonderful differentiator and an attribute of Augusta Health that, again, is an example of how we live into our mission. Another unique attribute of Augusta Health is that we are an affiliate of the Mayo Clinic Care Network. And the network is a very prestigious group of high quality, high performing community hospitals that actually have to be approved by the Mayo Clinic Board of Directors before they can become part of the network. The Mayo Clinic Care Network will provide opportunities that will be very rich for the educational curriculum and the training of our internal medicine residents. We have access to their clinical content, we have access to consulting opportunities, we have access to clinical protocols, we have access to second opinions, which I think is a really great opportunity for patients in our community. And again, this is at no cost to the patients in our community. I just see that as a really wonderful education and training tool for our internal medicine residents here at Augusta Health as well. Our mission is to strengthen the health and the well-being of all people in our communities. And we invite you to become part of that mission by participating in an innovative, new, community-based training program geared to clinical strength and building the next generation of physicians.